Hi everyone, and welcome back to the channel. In today's video, we're diving into a critical health issue facing India, something often called a silent pandemic. We're talking about antibiotic resistance. While antibiotics have been lifesavers, their effectiveness is rapidly declining in India, with potentially devastating consequences. Stay tuned to understand why this is happening and what can be done about it. In India, the reality of sepsis is staggering. 1 in 6 patients battling this condition falls victim to drug-resistant infections. Imagine being in an ICU, surrounded by machines, fighting for your life, while the odds are stacked against you. The Indian Council of Medical Research warns us the situation is deteriorating. Each day, more lives are lost, not just to sepsis, but to the growing threat of resistance. We must act now, raise awareness, push for better treatments, and support our healthcare systems. Every life matters, and together we can change this narrative. New surveillance data reveals a shocking trend. Klebsiella pneumoniae and Acinetobacter baumannii are now resisting even our last-line antibiotics, like carbapenems, with resistance rates soaring above 40%. And it gets worse, over 65% of E. coli strains are resistant to common fluoroquinolones. This isn't just a statistic, it's a wake-up call for our healthcare system. These superbugs are evolving faster than our defenses, putting countless lives at risk. We need urgent action to combat this growing threat and protect our ability to treat infections effectively. In recent studies from a South Indian hospital, researchers discovered something alarming. Nearly half of the A. baumannii strains tested were resistant to carbapenems, a last-resort antibiotic. What's even more shocking? Many of these strains carry not just 1, but 3 different resistance genes, all within a single organism. This highlights a growing crisis in antibiotic resistance, making infections harder to treat and raising serious concerns for public health. It's a stark reminder of the urgent need for innovative solutions in our fight against superbugs. The Ganga River, fed by glacier, is not just a lifeline for millions, it's a treasure trove of scientific discovery. Recently, researchers from CSIR NEERI uncovered natural bacteriophages in its waters. These tiny viruses have the power to target and destroy superbugs like escape, which are resistant to many antibiotics. This breakthrough could revolutionize phage therapy, offering new hope in our battle against antibiotic resistance. It's incredible to think that the solutions to some of our biggest health challenges might be flowing right through this sacred river. A silver lining indeed. Nifithromycin is making waves in the biotech world, representing India's first new antibiotic class in 30 years. Bugworks, a dynamic startup, has taken this groundbreaking antibiotic into phase 3 trials, a crucial step towards addressing the urgent global crisis of antibiotic resistance. Imagine a world where infections are effectively treated with innovative solutions. Nifithromycin is not just a drug, it's a beacon of hope for patients and healthcare systems alike. With its unique mechanism, it targets bacteria in a way that existing antibiotics can't. This journey from seed to launch is a testament to the power of innovation in Indian biotech, paving the way for a healthier future. Antibiotic resistance is skyrocketing in India, and it's a complex issue. Many people take antibiotics unnecessarily, even for viral infections, thinking they'll help. Then there's the problem of incomplete usage. People often stop taking their meds midway or self-medicate with leftover pills. In agriculture, antibiotics are routinely fed to livestock, which seeps into our food and water supply. Overcrowded hospitals and poor hygiene create perfect conditions for outbreaks. Plus, our rivers and sewage systems are contaminated with antibiotic residues. With lax regulations allowing easy over-the-counter sales and irrational drug combinations, it's a recipe for disaster. And let's not forget, bacteria can share resistance genes, even across different species. It's a ticking time bomb for public health. In 2017, India took a bold step by adopting its National Action Plan on antimicrobial resistance. Fast forward to today, and the NARSnet is actively monitoring resistance in 50 centers across 27 states. In 2024, a significant move saw 156 irrational antibiotics banned. States like Kerala are leading the charge with Operation AMRITH, making all antibiotics prescription only. Hospitals are now implementing stewardship programs to keep a close eye on prescribing practices and sanitation. Plus, campaigns like the Red Line and World AMR Awareness Week are spreading the word, educating the public on the importance of responsible antibiotic use. It's a crucial fight for our health. In India, our rural clinics struggle to provide basic care, while urban hospitals overflow with patients. The burden of infectious diseases weighs heavily on us, and with 10 billion antibiotic doses expected this year, we're at a crossroads. Poor families face the harsh reality of prolonged illness, pushing 2.2 million into poverty by 2030. If we don't act now, antimicrobial resistance could slice 1.5% off our national GDP. It's not just a statistic, it's a call to action for our health and our future. We must prioritize better regulations and responsible antibiotic use to protect our communities. We're at a pivotal moment in healthcare, and there's real hope for the future. Imagine scaling up Kerala's enforcement model across the country to ensure better health standards. We need to invest in Indian R&D for phages and new drugs, unlocking innovative treatments. Let's not forget about our environment. Treating hospital sewage before it reaches our rivers is crucial for public health. And with AI and digital records, we can empower doctors to prescribe smarter, making healthcare more efficient. Together, these steps can transform our health landscape for the better. Antibiotic resistance has been called a slow tsunami. But in India, the waves are already crashing at our hospital doors. We still have time. With bold policies, responsible use, and scientific innovation, we can still turn the tide if we act fast and act together. Like, share, and subscribe for more health updates. Comment below. Have you ever taken antibiotics without a prescription? Follow us for the latest in medical science and innovation in India. Meet you in next video. Stay healthy, stay fit,